How does the tumor microenvironment affect follicular lymphoma progression? Imagine a bustling neighborhood where the local environment influences what happens inside. In follicular lymphoma, a type of non-Hodgkin lymphoma, the surrounding cells and signals play a big role in how the disease develops and progresses. The tumor microenvironment is like this neighborhood, filled with immune cells, stromal cells, and signaling molecules that interact with the cancer cells. These interactions are complex but crucial for understanding how follicular lymphoma grows and evades the immune system. The microenvironment around follicular lymphoma cells resembles normal lymph node tissue, especially the germinal center where B cells normally mature. But in lymphoma, this environment is altered by the cancer cells. They recruit various immune cells like T cells, macrophages, and follicular helper T cells. These cells communicate through signaling molecules called cytokines and chemokines, which can promote tumor growth or suppress immune attack. For example, lymphoma cells can re-educate macrophages and T cells to support the tumor instead of fighting it. This creates a supportive niche that helps the lymphoma cells survive and multiply. A key way the microenvironment influences lymphoma is through immune evasion. The cancer cells manipulate immune cells to avoid destruction. They induce T cell exhaustion, where T cells become less effective at attacking the tumor. They also increase regulatory T cells, which suppress immune responses. These tactics help the lymphoma cells escape immune surveillance, allowing the disease to progress unchecked. Macrophages, a type of immune cell, have a dual role. Before treatments like rituximab became common, high numbers of macrophages were linked to worse outcomes because they supported tumor growth and new blood vessel formation. But after rituximab, macrophages can help kill lymphoma cells through a process called antibody-dependent cellular cytotoxicity. Other cells like mast cells contribute by promoting blood vessel growth, helping the tumor spread more easily. Genetic changes in lymphoma cells also influence the microenvironment. The most common genetic alteration is the T14/18 translocation, which causes overproduction of BCL2, a protein that prevents cell death. This makes lymphoma cells resistant to apoptosis, or programmed cell death. Additional mutations in genes that control epigenetic regulation can change how genes are expressed, further helping the tumor manipulate its surroundings and evade immune responses. The lymphoma cells and surrounding cells secrete cytokines and chemokines that attract immune cells and stromal cells, shaping the microenvironment further. These signals can promote inflammation, immune suppression, and tumor growth. For example, certain chemokines draw regulatory T cells and macrophages into the tumor, reinforcing immune evasion. Cytokines can also exhaust immune cells, reducing their ability to attack the lymphoma. Clinically, the makeup of the tumor microenvironment can influence how well a patient responds to treatment. A higher presence of active cytotoxic T cells often indicates a better prognosis. Researchers are exploring therapies that modify the microenvironment, such as immune checkpoint inhibitors, which aim to restore immune function and improve outcomes. Understanding these interactions helps scientists develop targeted treatments that can disrupt the supportive environment around lymphoma cells, potentially leading to better control of the disease. In summary, the tumor microenvironment in follicular lymphoma is a dynamic and complex system that supports tumor growth and helps the cancer evade immune defenses. By studying how immune cells, signaling molecules, and genetic changes work together, researchers hope to find new ways to treat this disease more effectively. Always remember, if you or someone you know is affected by lymphoma, consulting healthcare professionals is essential for personalized care and the latest treatment options.